All right, Joanna. So, give me a little bit about what was going on with you before you came to our office.
When I initially came, I was having back pain almost every day, sometimes for short periods, sometimes for long periods. And that's why I initially came, but I actually also had, I have a heart condition, and I'd had several surgeries and procedures and had a long list of medications. And so that's kind of where I was initially, but I didn't come for the heart stuff, but I've had heart benefits.
So didn't you even have like a pacemaker?
Yeah.
So how old were you when that was actually?
When I was 25, I had the pacemaker placed, so 5 or 6 years ago.
Okay.
And have had several, surgeries related to that, and ablations and cardioversions because of abnormal heart rhythms.
Well, tell me a little bit about what was going on as far as like the differences you saw with your pacemaker before you came and then after you came, what they were doing with the surgery.
Initially, I was having cardioversions sometimes every month, sometimes every 3, 4, 5, 6 months. And after coming here and being adjusted and doing the exercises and trying to focus on being healthy, you guys really encouraged me to continue my yoga and to eat right. And since then, I'm now at a point where it's been 14 months in between cardioversions, rather than one every month for several months. So pretty big impact on that. The other thing you guys don't even know yet, I went to my doctor this morning, and there's a certain section of the heart that was enlarged. And if you compare coming to Lane Avenue to now, it's smaller and it's now normal. So, so I've seen measurable changes in the occurrence of the arrhythmias, in the size and shape of my heart, but some of it's measurable as far as how I feel.
So I mean, that's probably that's actually really awesome.
I know.
What would you like if you could say something to someone out there? Like the differences that you've seen since you started with us. What would you say to them to like make them aware of what we do here and how it can affect their overall health?
I would say that in the beginning I was skeptical, that I was unsure how big of an impact this would have, not only on my back, but on the rest of my body. And that, the chiropractic work alone, I think, has had a big impact, but that it's essential to also pay attention to what you're eating and you're sleeping and managing stress and being active. So I think all of those things together give me the best benefit.
That's fantastic. Thank you, Joanna.
Thanks.